Today we've had Health Innovation North 2025. The second time we've come together across the entire North through our 4 health innovation networks, bringing together our ecosystem of innovators, hospital trusts, leaders, national leaders, policy leads, economic growth experts to have a conversation about how we celebrate and then champion and power up even more the great health innovation that happens across the North.
The health innovation networks can be the thing that shares evidence, supports innovation, see if things can be evaluated properly, connect people, learn from other places. And that thing that's happening in the room there about joining people or building relationships across sectors is really, really important.
The NHS has really identified the 3 key shifts that it's trying to make in terms of its Fit for the Future 10-year plan. So that's all around analogue into digital, treatment into prevention, acute care into the community work. So we're trying to establish how partnering across multi-sectored industries and how we all come together with one voice to be able to identify what those shared challenges are, but then actually do something about it.
It's a really exciting plan. It's about getting the NHS to really reach out and achieve the outcomes that we want in the population, but also do it in a way that's value for money and helps the productivity of the country. The health innovation networks are a fantastic leader, I think, in how you make that partnership happen on the ground. And they can bridge those cultural divides between the private sector, the public sector, the NHS, universities, to bring them together to make that difference.
I was asked to speak on the panel that's talking about women's health. I'm really pleased to see women's health specifically on the agenda. You don't always see it on the agenda at sort of health conferences and events. I'm quite passionate about looking at ways that we can close the gender health gap. I think innovation is important massively. A lot of these issues are going to require innovative ways of thinking in order to tackle those problems.
Today I've been talking a little bit about digital technology in the NHS, in particular the opportunity for AI to transform NHS productivity. The real value of this is just the scale. To be able to get to all of these partners and customers would take so much longer, so it's fantastic convening for them, and also to hear the content, the conversation that you get both from the sessions themselves and informally in between.
I think it's that massive reminder of the talent that we've got. Actually, it is our people in the North that are our greatest asset. There's a lot of people working at the coalface seeing patients today. So it's really incumbent upon us to make sure that we use this time wisely and that we all take back ways in which that we can innovate more, the things that we've learned from each other today to improve things for patients.
It's really easy to get lost in the big stats of the NHS and the waiting list and the financial position. They're all important, but it can make you feel like the NHS isn't innovating. It's innovating everywhere, rapidly, on every doorstep. We are really trying to tear this up and change the system for the future.
Today was about recognising not just what can happen across England, but what's here in the North. Homegrown innovation, people who are developing their companies here in the North. That's not just helping northern patients fastest, but it's also bringing those jobs to the communities that need them the most.